Hi guys, Dave Man Mexic, and we're back with the doc, and we got some good questions for you guys today, Doc. Let's get started.
Sure. First question is, hey Doc, great videos, thank you. Want to ask for your opinion, if I may. I started a testosterone enanthate cycle, 250 milligrams twice a week, but didn't have on hand Arimidex for the first 3 weeks. I just got it now and took it 3 times, but my nipples are already swollen, not much, but definitely visible, and it kind of freaks me out. It would freak me out too. I asked around, and because it seems I'm more prone to this problem, I should switch now to Aromasin. My question is, should I stop taking the test, or the Aromasin will help my nipples get back to normal, even if I continue taking the test? The next injection should have been yesterday, but I didn't take it yet. So if you could please give me your advice if I should stop the test, or is it safe to keep going? Thanks a lot for any information you can give me. So the typically when I see gynecomastia, the official name for the colloquial term, bitch tits, is you start growing breast tissue because of the increase in estrogen. Testosterone is a substrate from which estrogen is made, and your body, your liver specifically, although your fat cells can do it too, but mainly the liver will start getting really efficient at keeping a ratio of testosterone to estrogen, and you raise the testosterone, you're going to bump up the conversion to estrogen. So it can happen quite quickly. There are things that you can do to accelerate that, such as drinking alcohol tends to increase the particular liver enzyme that will increase the conversion rate. Also, there's a correlation between smoking or taking, anyhow they do it. I know they do it now with not just smoking, but vapor and eating and all this. But marijuana is my point.
Yeah.
And I've had guys that have come in saying they thought it was secondary to taking nandrolone and prolactin increase. I have never lost a bet. I said, well, let's test you, let's not guess. But I said, I'll pay for the test if I'm wrong. But and we might have reviewed this before. I'm sorry if I'm repeating myself, but it's almost, well, in my experience, it's invariably excess estrogen being created, because when you add something like nandrolone, which purportedly doesn't convert, a better example would be Anavar, because it definitely doesn't. There's a small fraction of nandrolone that actually does convert, contrary to popular belief. But you forget that you're displacing testosterone. You're assuming they both have the same pair of tennis shoes and get to the receptor just as quickly. You've had testosterone on board, and now you're displacing that testosterone with something that, it doesn't convert, but now you've got extra, if you will, testosterone or something else that can convert into estrogen. So there's an excess estrogen that's usually the culprit, not prolactin. And in this case, I would assume, although I hate to assume, I think you're better off testing always, but because there's no evidence to suggest it is prolactin excess usually will reflect in the ability to express actually what looks like milk, from the nipples. Wow. When it's in excess, of course, all these are dependent upon how much you're taking and your body's unique ability to convert, etc. But based upon this question, it sounds like you've got early signs of gynecomastia, which usually, not always, means that you've got really high estrogen, because in my experience, you might get water weight gain first, might get sort of moody and irascible long before you get the gynecomastia. So my guess is that this particular gentleman is a converter, I call it, and whether it's Aromasin or Arimidex, you need to get on something to block that conversion. I know we talked about this in a prior video about the difference between Aromasin and Arimidex, so I won't go into that. But what I do when I see someone who's already got gynecomastia being formed, first of all, if it feels like it might be the size of a marble, it's typically the size of a golf ball. Yeah. I'm not a surgeon, but I've assisted in several gynecomastia surgeries, and it's amazing to me, once we open up how much larger the growth is than we thought.
It's like an iceberg.
Based upon estimation, superficially. But what I do is I use tamoxifen right away, because then immediately you're blocking the receptor. And I know it will reduce the efficacy of Arimidex anyway by, I forgot what the percentage is, but it's something akin to a 10 or 12% reduction in Arimidex's efficacy when you combine the two. But who cares? In the beginning, you just want to block the receptor, no more growth. And oftentimes it will reduce itself enough, the gynecomastia, that it's not an issue.
So it can actually reverse the pattern a little bit?
My hallucination is I can't prove this, because what I was going to say is usually it reverses enough where people go, oh, it's gone.
Okay.
Now, those aren't people that then go have surgery and it's for sure gone. But practically speaking, it's not an issue anymore. Who cares?
That's not bad.
Gynecomastia and breast cancer, by the way, are not associated. They're two different things.
Yeah.
So again, people wouldn't necessarily go in and say, well, I had it, now it's better, but I want to get rid of this. So I can't prove that. Mm-hmm. But what I have seen clinically is that the gynecomastia will either be reduced enough so that you don't worry about it anymore, or it won't, and we find out, okay, this is permanent. Now you have to decide if you're going to deal with this or not. It's a cosmetic issue, obviously, but for a lot of us, it's a pain issue as well. When it's being activated by estrogen, you just bump it. You're, oh my God, that hurts. Yeah. So my point is that you get on the tamoxifen right away. I'll usually put someone on it just because it makes them feel more comfortable and it's not harmful for a full month, along with the aromatase inhibitor, because then you're making sure that there's no conversion into estrogen, but you're immediately blocking whatever's estrogen is already floating around in the system with the tamoxifen. So that's just my little
How much tamoxifen? 25, 50 meg?
10 milligrams twice a day is usually more than enough to help with, and people will notice it within a couple of days typically. Wow. And then hopefully you catch it early enough that it shrinks down enough that it's not an issue. And then of course make sure you're taking your aromatase inhibitor or Gynecomastia, whatever works for you. Yeah. As I've said before, I'm not a big fan of blocking estrogen, meaning at the receptor level, letting it be created. First of all, it doesn't make sense to me if you're replacing testosterone, to allow it to convert to something you don't necessarily want all that much of anyway. You want to spare the very thing you're inputting exogenously, the testosterone. You want to keep that from being converted. Much more elegant way of doing it, right? You keep your testosterone, just allow what little bit of estrogen you need to be converted, instead of who knows how much you're converting without that AI, and then you're just blocking the receptors. The other thing I say is, who knows if, like Clomid blocks certain receptors, others it doesn't for estrogen. Like it doesn't block the estrogen receptors in the liver, which is considered a good thing. So how do we know that tamoxifen is blocking all the receptors? So to me, it's just much safer to just focus on, we know that sweet spot of estrogen, we use estradiol as a surrogate marker for total estrogen, but it's about 15 to 20 picograms per milliliter. Let's just shoot for that. And then we don't have to worry about, I don't want to say the details, but which receptors are being affected. We're just limiting estrogen. We're hitting it at the root level, we're at the branch level.
Gotcha.
Sorry, I know that was a really
That was a good one, though. I'm sure a lot of people will appreciate this one. Very cool. Thanks, Doc.